Good morning, Carol Johnson.
Well, good morning to you, Bob Ponce. How are you?
I am good. We are here again, and this morning we have a special report we want to talk about. We need to get into what's going on with vaccine poaching in Harlem. We need answers.
Oh, yeah.
Uh, it's time for us to really get in, and we've got the receipts, and we need to really get a sense of what's going on here. So let's talk about it. So going back to January 15th, and we could probably go back further than that and talk about things, but I want to show you this because we've got here an announcement where Governor Cuomo announced locations where the vaccine would be deployed for NYCHA housing developments. And here is a statement he made. It's a press release. And he comes out, and in this press release, he says, "We have one priority and one priority alone, getting shots into arms. And as we continue to work to expand the network of vaccination sites, it's critical to make sure the vaccine is distributed fairly and equitably. Fairly and equitably. And as you can see, there's 5 sites he listed: Bronx, Brooklyn, East Harlem, Queens, and Staten Island. In East Harlem, you can see highlighted 307 East 116th Street, which is a location we know as Corsi House. So we're going to come back to that. So this was the 15th. Now, what we started to see as we got further into the month is that we started getting more and more news reports of the inequitable distribution of the vaccine to Black and Latin populations. So, we're going to take a look at some of the other news stories that we saw. So, here's one from TheCity.nyc, which we've always seen as having good coverage. More than 1 out of every 4 people vaccinated in the city don't live in the 5 boroughs. Oh, interesting. And
Mm.
this story was by Reuben Blau and Will Welch, who we've had on our COVID update. So we're seeing that over 25% of the vaccinations that were supposed to be in the city came from people who are not in the city. That's interesting. And then we started to see more reports where we're seeing information that Black and Latin populations were getting underrepresented. So, the further and further we get into this, the more and more information we're getting about, what they're calling vaccine inequity. But what we're calling, it's not vaccine inequity. It didn't just happen. It's vaccine poaching.
Poaching.
And vaccine poaching is when vaccines that were supposed to be supplies that were supposed to be supplied to the neighborhoods, the Black and brown neighborhoods that were the hardest hit during this whole pandemic. And every politician keeps telling us that they know about the inequities, the distribution. We went through the same thing with testing, and yet here we are going on now that it's time for the vaccines to be distributed. Lo and behold, for some reason, um, other people are able to come into our communities and get the supplies that were supposed to be dedicated to our neighborhoods. So we're going to talk about what happened in the Washington Heights Armory. So here's another story. Outsiders get vaccinated at Washington Heights Armory that Cuomo touted as combating COVID inequity. So here's a story, and you can see the picture there of people coming to this armory. And this particular reporter, also for the city.nyc, tells the story about going to this armory, and as this reporter showed up there, she would see people coming up, showing up with Burberry scarves and Longchamp handbags and looking for parking. And as she queried 12 people who came in, 10 out of the 12 did not live in the 5 boroughs. They lived either in the suburbs or in New Jersey. And at the same point in time, the Spanish residents who came to this primarily Spanish speaking neighborhood to get a vaccine. There was no Spanish signage. There was no one there to translate for them. And the reporter was actually asked to interpret for Spanish speaking people coming. And when the person, a Spanish woman came, um, they had to tell her that she didn't have an appointment, and she had tried calling time and time again, but found out the process is difficult. And this seems to echo what we've heard, correct, Carol, about people having a hard time trying to book their appointments and either getting misinformation or not connecting at all. And yet, lo and behold, it seems to be easy for people to come from the suburbs in New Jersey, drive right in, get their vaccine, and drive out.
Yeah, and this is just consistent with this debacle.
Hmm.
That's all I can call it from the beginning of this pandemic to now. Here we
Hmm.
are, a few days past a year that
Hmm.
we first heard about COVID. And the old saying, if nothing changes, nothing changes. You can't keep talking about inequities and inequalities, because early on, when I kept hearing the term, I kept thinking, how stupid do you think we are? Honestly. So you remember us and you say that, and you think we're just going to hold on to that and keep it moving. But the first people that are left out of every last response to this pandemic has been inequitably dealt with. Black, brown people in every aspect. And so we are not surprised that this foolishness has continued. You know, um, we died in my area at 5 times the rate of people that were right across the street, Upper Yorkville.
Hmm.
And so, with everything, the testing, the PPE, and now the vaccine rollout, it's the same stuff, different day. We continue to be left out. Things still don't seem to ever get to the top to know how to fix it. You don't set up a plan and then work it for a year and then stop and say, well, how can we fix it? You kind of keep a guideline and watch it as it progresses or doesn't progress. And at that point, you change. You have to change something. What's going to make it work? That's what mitigation is all about. What's going to make it work? They're not doing that. They're not doing that. It's almost like a shrug of the shoulders. Yeah, we're gonna get to you sooner or later. But we really tired of the later part. Really affecting us.
Hmm. So we started out earlier talking about Corsi House, 307 East 116th Street in East Harlem. So let's talk about Corsi House. Now, as I said, I showed you a notice on the governor's website talking about House being a location for NYCHA housing, which is interesting because we also had another location that was supposed to have been for NYCHA housing called La Marqueta. We'll get back to that. But let's talk about what actually happened at Corsi House. So the same thing happened at Corsi House as happened at the Fort Washington Armory, which is a lot of people coming from the suburbs, coming from out of state, being able to come to Corsi House and get their vaccinations. But here's the interesting part about that. Corsi House vaccinations were supposed to be for NYCHA residents only. Now, last time I checked, there's no NYCHA housing in Westchester. There's definitely no NYCHA housing in New Jersey. So, how is it that other people were able to come to this location at Corsi House and get vaccines when Harlem residents couldn't even find out about it? And Carol, tell us how we know that Harlem residents couldn't find out about it.
Yeah. Well, first of all, one of my jobs is to check. the vaccine finder, the testing site, like daily. And so I never saw Corsi listed, because what I do is I copy that information, I take it out, I generally call the numbers to see if it's effective, because I remember calling numbers and getting email addresses, and calling numbers and not getting anybody, no comment about any vaccines. And so before we put that information out in our hub, the East Harlem Coads hub, we got to make sure that it's vetted. But I never saw Corsi House on the finder. So when I found out about it, this was maybe a week later. Yeah, it was about a week later. And so this place is in the neighborhood. People live there. How many people in that actually built in the actual building knew that there was vaccines available across the street, that there was vaccines available in there? We didn't know. But it's very interesting that people knew in Jersey and Staten Island, and you had someone who came from one of the official offices that is in charge of the response of this pandemic, where I got this information from. They spent 3 hours there, and the majority of the people were outsiders coming in. And so our question is, why can't you designate this for people in particular zip codes? You can't prove you live in that zip code, you can't get that vaccine that's designated for that zip code. Just like the testing sites. I could not get a test. I could not get a test in NYCHA housing because I could not prove that I lived in NYCHA housing. So how is it a vaccination site designated for NYCHA housing can allow people who don't live in NYCHA housing? So it did work. It did work. But why won't you apply that here? The same way they're doing Yankee Stadium. We can't get a vaccination in Yankee Stadium because we cannot prove we live in the Bronx. And so this was something that was thrown out some time ago. And we were told on a call recently, no, that's not going to work. Why won't it work? It's already worked. But it seems like every time something comes to our neighborhoods, it won't work. But it worked in the NYCHA houses in our neighborhood when we finally got the testing sites, because they were left out. Mysteriously, no. They were left out. I know East Harlem was left off the grid completely. But when they opened them up, only those residents could get it. Only the Bronx people can go to Yankee Stadium. But now when we say, well, why can't that vaccine be designated for 10029 and 35, which is East Harlem? No, that's not going to work.
It's just a travesty to get to a point where 25% of the vaccines that were supposed to go to the areas that needed the most went to other people, and we're not hearing answers. And the solution is that simple, and we know the solution works because they did it for other things. So it's not like we're not coming up with E equals MC squared. It's a simple fix for this. So we need answers. So we're asking this question. If you're watching this, we need you to not only ask this question amongst yourself, we need to ask the questions amongst our agencies, our elected officials, because here it is once again. We're going on almost a year into this pandemic, and we're seeing the same types of patterns that we saw back last spring when we're in the middle of this pandemic, and we know they know from the data where the pandemic is hitting, and yet resources are being allocated elsewhere. When it came to testing, they set up a testing site in Central Park, which is the area that was the safest area in the city for COVID was Midtown Manhattan. Why were testing facilities not developed and placed in our parks uptown, or in the Bronx, where this pandemic was raging? And so we've seen it time and time again. This lack of deployment of resources to our neighborhood, and we're not having it anymore. It's got to stop. Vaccine poaching is a real thing. It's not inequitable distribution, it's poaching, where resources that were made to go to people in our neighborhoods were redeployed, where other people were allowed to come in, drive in, you know, grab their vaccine and go home. And at the same point in time, are people down the street not even realizing that this site is open because the vaccine finder that they've sent us to, that they've told us, check this site and you can find out where the vaccines are distributed, and it's not there. This is dereliction. This is it's unacceptable.
And
Unacceptable.
and again, there's a lot of people in our areas who do not have internet access.
Hmm.
We keep having this conversation over and over again. We saw what that phone number looked like. People were not getting in. And it's interesting how I got so many reports that when people did get through this number, they were sent like 2 hours away. They were sent way out in Brooklyn, you know, with an hour to arrive from this location all the way out to Brooklyn, which is, well, first of all, you got to get prepared to go because you get the call and they say, yeah, we have an appointment for you. We can see you today, but it's in an hour. Can you get here in an hour? Well, if I don't take it today, when can I take it? We don't know when we'll be able to give you another appointment. So you're expecting somebody to get to a location in an hour when it's an hour and a half trip. And you're not even prepared to go out. You're prepared to get an appointment. And that's not what's happening. Ulster County, 3 hours away. I mean, but it's interesting how we could get these calls to go way out there and get people probably from there is coming into the city too. But they're successful. They're coming in because somebody is letting them know that these sites exist.
That these sites that exist and they're not being heavily utilized. And it's you know it's hard to think about this thing being by accident when you have people who are able to come to a site when the people who live there can't find out about it, and yet they magically know about it and they're given access. And remember, as we said, the Corsi House site, according to the governor's information that was put out on January 15th, was only supposed to be for NYCHA residents. So it's not even people in the neighborhood. It was specifically for NYCHA residents. How were people allowed to go to this site and receive vaccines?
And the saddest part is that this is why we have to always maintain more vigilance than other people do,
Hmm.
because we know that these things exist consistently, historically. Um, when when they began to open these sites,
Hmm.
they were given to medical clinics. Okay, so we have two clinics here, and then
Hmm.
we have the Health and Action Center, which is Department of Mental Health and Hygiene. Um, Now, from what I understand, the two medical centers we have is giving vaccine. One, Borican, is only giving vaccine to their patients.
Hmm.
I get that. Settlement Health is giving it to their patients first. Then other people can make appointments. I get that too.
Hmm.
But the fact still remains, Where are the other sites? You have Metropolitan Hospital. Now they want to open it up in. A matter of fact, I got a text message yesterday that my pharmacy is giving out the vaccine. Well, my pharmacy is such a small place. Are they still making people wait those 20 minutes to be monitored before they go home after the vaccine? Or they giving the people the vaccines and just sending them on about their business? But that was it. You're supposed to be monitored 15 to 20 minutes. I can't see anybody being monitored like that in this really small place. Because I got my flu shot there, and we literally had to keep playing. People had to leave because it was myself and my electric scooter. There was another wheelchair in there, which was a big electric wheelchair. In order for people to move around, folk had to literally go outside so that the chairs could go around the displays so that other people were coming in to get their medication or pick up whatever. So I was sitting there then saying, wow, this is weird. The last time I was in there, I just thought about that place. And of course, I didn't know that they would be giving vaccines. The first thing came to my mind was they're opening this up to pharmacies. I wonder if they're going to do it in at my pharmacy. That can't happen. There's no space for that to happen. So I don't know how they I don't know how what the thought process is of the people who's making these decisions, because they're just not very bright. They're not bright decisions at all.
Hmm. Hmm. Well, as we said, this is unacceptable. We're asking for answers. You should be asking for answers too. If you're watching this, we ask that you share this. Um, with your friends, family, put it on social media. If you have relationships or contacts with your elected officials, we need to start asking these questions now, and we need answers as to why it occurred and what are the protocols for making sure it doesn't happen again. Because 25% of the vaccines that are supposed to have come to New York City have gone to people who live outside of the city, including people coming from out of state. That's ridiculous. That is crazy. It's unacceptable, and it's easily solved simply by checking. But with people are coming in, driving in, they've got a driver's license. Show us your driver's license. Oh, that zip code. You're not authorized to pick up from here. Sorry, thank you. You know, and these are the simple solutions. You know, Going a layer back further, we need to understand how is it that people outside of our neighborhoods know about it when we have a situation when it's not on Vaccine Finder. So they didn't just go to Vaccine Finder and say, "Hey, they're doing vaccines in Harlem. Well, let's go there." They
Right.
they must have gotten information from someone else.
It's got to
And
be inside trading.
right, right.
you know.
So we need some investigations. We need this thing to be solved, because we are not going to sit by and allow this continued disparity of resources to the neighborhoods that have already suffered the most from this pandemic. We've already lost the most. We've lost the most people, and we're not even talking about, aside from loss of most people, we still have people who are suffering from the long term effects. No one is even talking about this at this point in time. But there is a mountain of people who have had COVID and have recovered from the worst part of COVID, but are suffering all different types of long term effects from this virus. And and we're going to be dealing with that for some time to come. So for us, when the so-called solution shows up, but it doesn't show up at our doorstep, that is not acceptable. Period. So
And you know what's really weird about this is that while we wait and we continue to wait. And it would be understandable if you say, okay, we're waiting, everybody's waiting. We can't roll this out in a certain way. Everyone's waiting. But the same way we waited for PPE and waited for testing sites and still waiting for testing sites, we keep getting these pop ups. They pop up one day, 2 days, they're gone. They come back the next month, you know. Um, and so places seem to be opening up because when you look at what are described as mass vac sites, they're supposed to be 24/7, still by appointment. However, when you look at it, there was five that was designated, and the first three of the five was Bathgate Industrial Park in the Bronx, Brooklyn Army Terminal Annex Building in Brooklyn, La Maqueta, which is in East Harlem, then Queens, and then Staten Island. So the first three, the third one is East Harlem. This was announced on January 5th. It was supposed to open January 12th. Are we like a month out?
it's February 10th now, and that location is still not open.
It's
And
not open. It's still not open. But here's the thing, when did the Armory open?
um I don't know, but we know it's open. Let's see if I can find out when it opened.
And the point is that while Bob looks for that, the point I'm making is that that still has not opened. And yet, a couple of days ago, you opened up a mass site in the Bronx at Yankee Stadium.
Mm-hmm.
Yankee Stadium is not here. It's not included in this list.
Mm-hmm.
But you said, okay, we're gonna get those people vaccinated in Bronx because they're vulnerable people too. But you keep jumping over the vulnerable people that had the most infections and deaths.
Mm-hmm.
And so now the same energy that you put into opening Yankee Stadium, why are we still sitting here waiting for La Maqueta? Now, the last word we got, originally they said it's just going to be a mass vac site. You call, you make an appointment 24/7. You can get the vaccine.
Mm-hmm.
Then it turned to, well, that site's going to be for NYCHA housing.
Mm-hmm.
So we started fighting. Why would that be for NYCHA housing? Each NYCHA development has one, and most of them have more than one community center, which is large enough for you to vaccinate people, socially distance people as they sit, to be monitored after, post vaccination.
Mm-hmm.
So now we're back at La Maqueta. It's still not open. Why? Why? So you're doing the rollout to the projects. We haven't seen the list to see which one of those places are going to be in what they call, and we know to be, the hardest hit areas.
Mm-hmm. Mm-hmm. And so, what we know with the Armory is that after the report came out from the city, they were able to change a day later and say, okay, now we'll start to limit it to people from the area. So they were able to change on a dime when they got exposed by the media. But why were they doing that in the first place? And we're still not getting answers. There's so much lack of transparency of information, that it would get to that point because it wasn't just the Armory. The Armory got exposed, but we're seeing, what we're seeing in Corsi House was even worse because it wasn't even on the vaccine finder. So how were people allowed to find that out? And then uh, the third location we keep talking about, La Marqueta, which is not even open yet, even though it was announced to be a 24/7 vaccine distribution site, that was very, very accessible, and where we haven't, no one's come back to us and saying when it's going to open or what happened or why it didn't open. There's a continual lack of transparency of information, misinformation. And so every time they come out with a statement and saying, hey, here's the location where it's going to happen, and then things don't occur there, and then people are trying to find out, it seems like there is no coordinated effort to get clear, concise information to the populations that need it. There's no coordinated effort to make sure that that information is available in multiple languages, that multiple ways to get to people are available. As you said, everybody doesn't have internet access. We already know about the digital divide that occurs in these communities. So it's not rocket science to understand that we've got to use other means, whether it be radio. We have access to the local radio station here, WHCR. We can get messages on there. We haven't been given those messages from our contacts at Department of Health and Mental Hygiene. We're not getting downstream information to get disseminated into the community through community organizations such as the East Harlem COAD, the organizations that fought tooth and nail, day and day, distributing PPE throughout this entire pandemic. The city knows who we are. They know where we are. They know what we've done, and they know that we have access to getting information out. We're here every Wednesday morning for the last 46 weeks. We've been here giving out information about COVID. So it's not hard to find ways to get this information out there. But if it's not a clear top down approach to making sure that clear, concise, accurate information is being given out to these communities in terms of distribution, how on earth can we even think that this is the efforts that are going to stop this pandemic? I don't understand it.
Yeah, because you spend enough time, like gaslighting, and it then in the interim, all of this stuff starts happening around the initial project. The project is get get the shots in the people's arms. Another catchphrase. I think they spend more time creating catchphrases than they do creating a solid response. You
Mm-hmm.
know, um, so it's not like you're not getting it. It's not like you don't have the locations. Um, because a lot of places are opening up before the designated places have opened. Now that's pretty odd to me. That not only um, Yankee Stadium, but Wale Junior High School now has a vaccination center. There's another one over there in West Harlem that has
Mm-hmm.
a vaccination center. So
Mm-hmm.
these places weren't even on the radar.
Mm-hmm.
And yet we're still sitting, waiting for one that was designated.
Mm-hmm.
So it's not like you can't get it. Why would you open up new sites if you don't have any vaccine for them? So you've
Mm-hmm.
got the vaccine and you've got the site, but for some reason it's like every time they mention the inequity and every time they mention the hardest hit areas, it kind of goes in one of their ears and out the other.
Mm-hmm.
Because that quickly, the very areas that you, quoting the governor, I will not get the vaccine until black and brown people get theirs. And now all of these different places, all of these different vaccines. Oh goodness. I read a story in Staten Island where the lady got the vaccine, could not get an appointment to get the second vaccine and went someplace else and got that vaccine. How does that happen? Your
Hmm.
follow up is supposed to be at that original location because it's bad enough their bookkeeping is horrendous. They can't seem to get the metrics together so that the databases are accurate. The information in the databases is accurate. But this woman actually went and got it someplace else. And not only did she get it someplace else, she got Moderna and she got Pfizer.
Oh, what?
You
That
know,
doesn't
and
make.
the whole idea of getting that little card is
Hmm.
so that you are reminded where you're supposed to go to come back, the date, the time of your appointment, and it says what you're getting. And this woman searched. Apparently, she went from place to place to place until she found somebody that would give it to her.
Hmm.
So, how is that happening? Because once you come in and you're coming for the second shot, you have to be able to prove that you got the first one.
Hmm.
So, with no proof, okay, if you say, well, I don't have any proof because you don't want to show the card from the other location, well, you shouldn't be able to get a vaccine. And if you show the card and it says, well, you had this vaccine at County General in Queens. You're in Staten Island. We can't give you a vaccine here. You have to go back to that location. How did that
Right.
happen?
And
And they
then,
don't even. I'm sorry. I just wanted to say they don't even know. I was reading an article on different vaccines. Would they be as effective if you take one shot of one and one shot of the other? So this woman was like a guinea pig. Somebody allowed her to be a guinea pig and get those two different vaccines.
we got to do better. So, so this is the only story we're going to cover for this morning. And it's the one that is, closest to us and the one that we need to get information out on. And we're going to say it, and we're going to continue to say it. We need answers on this because this cannot continue. you know and it's not enough to fix it in one location. We need to understand that it's a fix in all locations. We still need more transparency in where the vaccine is going to be available, and we need to know and understand without a shadow of a doubt that all these locations have protocols in place to make sure that the people in the communities where they're supposed to be served actually get served, actually get the information, and have an opportunity to get second shot follow ups. Or else, what are we doing here? You know, what are we doing? So,
Wrecking and creating more havoc,
hmm
more as they say, hesitancy. You know, a lot of people who didn't want it has had a chance to hear of people that had it, close
hmm
friends, relatives who have had it, and did well with it, and they're like changing their mind. There's a lot of people who took a wait and see approach,
hmm
and so they waited and they saw, and they got less afraid to take it. Then there was no vaccine available. And now that there's more being doled out, they still don't know where to get it.
hmm and they continually are looking to community activists to do the work that needs to be done, and yet we're not getting information, we're not getting resources, we're getting double talk, and it's not acceptable. We're not going to go ahead and do it. We must find another way. So we ask you, if you're watching this, share this information with your people in your circle, share it with your elected officials, call them, write them, text them, email them, whatever. And we need to collectively find ways to answer these things, and we need them right away because it just is unconscionable. As we said, 25%, 1 out of 4 of the vaccines that were supposed to have been distributed to New York City residents have gone to people outside of the 5 boroughs and even outside of the state. And it's just it's too simple a problem to fix for it to be an acceptable answer. Oops is not an excuse.
Yeah.
Yeah. So that's it. We will be back with you. Got a message from our brother Mark Mafee. Yes, there must be consistency and accountability. That is exactly what we're talking about. We need consistency, accountability, and above all, we need answers to why vaccine poaching at this day and age. We're in 2021 now from the virus that was called the 2019 virus, you know, and for us to get to this stage where vaccine poaching is a reality, that is not acceptable. So we thank you for joining us, and we will see you next week.
And as always, stay safe. Make sure you wash your hands frequently. Wear your mask over your nose and your mouth. Now it's even suggested that you double mask. If you're wearing a cloth mask or a scarf, that you get um, the 2-ply, 3-ply surgical mask and wear them underneath. There's different variants out there that are not as dangerous so far. That's what they say, but they are there. And there are cases where people actually have two variants of coronavirus in their system, and we don't want that for you. So make sure you do that. Make sure you socially distance. Don't get an attitude when the storekeeper says back up. You have to wait online. We got to learn how to be courteous. That's how we're going to survive this thing. And again, continue to wipe those frequently touched surfaces in your house, particularly if you live with a family and people are going in and out. So stay safe, stay vigilant, stay courteous, stay respectful. We'll get through this thing together. We can. We just got some work to do. That's all. But we'll get through it.